All right, let's get started. Good afternoon, everybody. Thank you for coming to another edition of the Florida Healthcare Simulation Alliance. My name is Mariano Lu. I'm the technology leader for the Alliance, and I'm also the director of simulation and skills education for Pepperdine University. I want to thank you, everybody, to register for this event. And today we have a very exciting topic, turning simulations into escape rooms, which is a very hot topic recently in nursing education. So we have our esteemed speaker, Helen Mills, who comes via the VA hospital. She has a long title, so I'm trying to figure out. Sorry, but she is a national clinical faculty lead facility for the SimLearn in Orlando, Florida. So without any further ado, please, Helen, take it over.
Thank you so much. So again, I'm Helen Mills, and it's very nice to meet you. And I'm thrilled to be here to talk to you about a topic that's near and dear to my heart, making simulation even more fun and exciting by turning it into escape rooms. Before I begin, because I work for the government, I need to give a disclosure that I'm presenting on my own time. So I'm not representing the government, the VA, or SimLearn in any way. That's the sign of the times. It's just a disclaimer that I need to add. But a little about myself before I start. I've been a registered nurse for 32 years. I've been in simulation for 15, and I have my PhD in nursing research and education with my dissertation based on simulation, advancing nursing through simulation. So it's a topic that's near and dear to my heart, and I'm thrilled to share it with you. So this presentation will discuss using escape rooms. We'll identify 3 key benefits for using the escape room in education and how to develop ideas for an escape room, as well as 12 specific steps that were designed to turn a clinical simulation into an escape room. And then we'll talk about some escape rooms that we've run, and we'll evaluate a mini escape room experience together. So before I begin, I like to complete my presentations with a little bit of conversation. So I would really like to hear from you, and I need to know what do you feel that makes simulation effective?
To me, it has to be engaging.
Engaging. Yes, it absolutely has to be engaging. Anyone else?
I guess effective debrief.
An effective debrief. Yes, that makes simulation effective, because we know that debriefing is where most of the learning happens, right?
Yes.
Realistic.
Realistic. The more realistic it is, the more memorable it becomes. But the thing about simulation that makes the education so effective is that we're putting someone in an environment where they see the things that they would normally see. They hear the things they would normally hear. They feel the things that they would normally feel. They're using muscle memory and all of their senses to hone in on that educational experience. And what happens is, scientifically, it creates a status for our bodies. When you're in the same place, the same time. Have you ever had something bad happen to you, and then if you're in that same spot again, you look around and the hair on your neck goes up? Your body just makes a physical response to a situation. And what simulation does is it creates that physical response to the learning, and that physical response is what creates memory that lasts. It forges a long-term memory. So education through simulation, when done effectively, can not only create new knowledge, but new pathways for that knowledge, which makes the critical thinking more possible. And it's been very effective in education. But what we know is that we don't know what we don't know. So let me give you an example. When years ago, I worked for the Cleveland Clinic Hospital System, and I was asked to educate all of the critical care nurses on the new stroke policy, which wasn't that unusual. When the nurses looked at it, they rolled their eyes and said, "We're critical care nurses. We know how to take care of stroke patients. Why do we have to come in on our time off and do this?" And they were very upset by this. But the policy was that we needed everyone to go through this training. So we set up the training. And when they first came through, they were very aggravated and annoyed because they felt like they didn't need to be there. But after going through the training, what they discovered was there were things they weren't aware of that they hadn't known, things about the policy, things about the way that they did things. And because in debriefing, we encourage participants to discuss things amongst themselves rather than someone standing there pointing out all their problems, it was coming from each other. And they were able to identify things together as a group that they otherwise wouldn't have even noticed. And because of that, they went out of there skipping and happy, feeling very good about the education, but it was also very memorable, and it was something that helped them to understand what they didn't know and what they needed to know, and it made it very memorable. The problem with this is that change isn't always comfortable. It can be frightening. It can be stressful. Anyone who's gone through change can relate to that. It's a little bit like the pottery making. You know, the pot has to be, the clay has to be molded and spun and burned and painted, and it has to go through this process before it becomes a beautiful vase. Well, same thing with us. We have to go through an uncomfortable or a difficult process from time to time, hopefully not severe. We don't want it to be severely uncomfortable, but a little bit of discomfort helps to cement that memory in place. But what we found was we know that the physical memory, the muscle memory helps. We know that the emotional memory helps, but we also found that fun really ignites the learning and helps to cement it into place. So if you can find a way to make it fun, then you're in a good place. So I want you to think about a time when you learned something that you didn't know in a way that you will never forget. Let me tell you a story about myself. And this is just a personal story. I'm not advocating for any religion or anything. This is just my personal story. So when my children were small, I took them to something called Vacation Bible School. It's a week-long activity where they would go to like singing and dancing and games and that kind of thing. And I volunteered to help out, and they put me in the elementary section. And I took these children from one section to the next, and there they participated in their activities. And my whole job for the day was to carry around this clipboard and make sure that I had the same number of kids at the end of the day as I did in the beginning. Doesn't sound very hard until you get a room full of toddlers. Well, we got into a sanctuary, much like this picture here, and had everyone sit down. And I'm looking at my clipboard, and I look at the children there, and I count the number of children, and I count the number on the clipboard, and the numbers don't match. And I look again, and I realize one of them is missing. I look everywhere, nobody shows up. So I run onto the stage. I grab the microphone out of the woman's hand, and I say, "Jesus is missing. Jesus is missing." And as you can imagine, it became as quiet as a pin dropping at that point. Someone looked at me and said, "Did you mean Jesus?" And I got to tell you, that day I found Jesus in church. And that was a memory that I will never forget, that things can be pronounced differently and be spelled differently, and that I needed to be aware of that. But that's a silly story, but it's something that is very memorable to me, something that I won't forget. And with escapes, that's what we're doing. We're creating something out of the ordinary, something extraordinary, something exciting and interesting, something that makes you laugh and stress a little bit and run around. But in the end, that adrenaline that you've caused is a good thing, and it's going to create a memory that they can talk about for years to come. So let's talk about escape rooms. What is an escape room? Have any of you been to an escape room? before, maybe one that you went to for with friends that we have them in Orlando all the time, where you can pay and go into an escape room and participate in them. Someone tell me about an experience that you had in an escape room. Okay, I've got some newbies. That's all right. Let me tell you about my experience. So my daughter loves escape rooms. We go to this one. It's a bomb shelter, and we walk in, and the doors are locked, and we have to solve this riddle before the bomb goes off. We have to stop the bomb from going off in order to escape the room. So we follow the clues and solve the riddles and unlock the locks. And when we get to the end, we run out of time right before we put the final code in to escape from the room, which frustrates me because I like to win. I'm very goal oriented. I like to finish what I start, right? In this particular escape room, they only allow you to have, I think, 5 clues. And the puzzles were really hard, and so it was fun. It was exciting. It was memorable. We laughed and we had a good time. But I also remembered not succeeding at what I went out to accomplish, and that would be the key difference between an escape room for entertainment purposes and an escape room for clinical purposes. An escape room for clinical purposes, the objective is you want them to find all the clues and figure out all the riddles, because that's where the learning takes place. If you design it properly, every time they achieve another step, they've learned something new. So we want them to be able to get to the end. Whereas in a regular escape room, you may or may not. Another difference would be timing. So many of the escape rooms that we go to are typically 60 minutes to 90 minutes long. Well, if you are an educator in a hospital setting, that's very difficult to achieve. And most of the time, we're lucky to get 20 minutes time for a sim, and then it takes twice that for the debrief. So that's 40 minutes. That's an hour right there. If you did a 1-hour escape room, it would take you 3 hours to finish the debrief. And that would be overtaxing, overstimulating, overwhelming, and it'd be very hard to get people to show up for that. So in clinical simulation, we suggest that you keep it short. Keep it to 15 to 20 minutes at the most. This allows them the time to earn what they need, to learn what they need, and the time to achieve what they need. And it gives you the opportunity to create the educational component at the end, which takes place in the form of a debrief. And yes, you do need to debrief with escape rooms as well, which doesn't seem like you would, but we'll talk a little bit later about how reflection makes all the difference in learning. So what are some of the benefits of a simulation escape room? Well, first of all, it's memorable. When there's memory, there's retention. So that's good. That makes it last longer. There's critical thinking and clinical judgment. Now, these things that I have listed on this page, these are things that I found in the literature. I didn't just say, yeah, I think these things happen. I actually went in the literature and looked up the research on simulation escape rooms to find out what the studies have shown. And they show that it helps people to think better, to make better decisions. It gives opportunities for feedback. There's a chance to talk about things that have gone wrong or could have gone better. There's opportunities for independent and collaborative thinking. Independent thinking is difficult enough to enhance, but the beauty of an escape room is that there's teamwork involved, because usually it happens in groups. And so everybody has to work together to create the solution in the end, which helps to bond people together. It helps with teamwork. It helps team building, but it also helps with the communication, because they have to be able to communicate. When certain clues are on one side of the room and another's on the other side of the room, they have to figure out how are they going to communicate between the two sides of the room in order to solve the problem, which is where delegation and teamwork comes in. Confidence, going through an escape room secures that memory in place. So the next time you come in contact with it, you remember it. And there's an automatic response to it because you've experienced it before. So that creates confidence. And that helps with time management too. When you know that you have 15 minutes to complete a simulation, you're more likely to be on the ball and not stand around. You're more likely to get into action as soon as possible. And so it does help with that. But the other thing that's really important is decrease stress and burnout. I don't know if you realize it, but there is a worldwide nursing shortage right now. I'm going to pick on nurses because I'm a nurse and that's what I know. But there's a worldwide nursing shortage. And nurses who are stressed and overworked tend to burn out much faster. By creating opportunities for them to learn and to enhance their abilities to do a better job sooner, it takes some of the stress away and it creates less burnout. And what that does is it adds to retention. Then our nurses stay longer. For every nurse that we lose, it costs about $70,000 to hire someone to replace them in training costs and in the hiring process. Saves a great deal of money by reducing stress. These are all reasons why simulation escape rooms are so beneficial. Okay, so how do I develop ideas for simulation escape rooms? Well, it's very similar to developing ideas for regular simulations, right? So you start with a list of topics. Where do you get those topics? Well, you can go around to the units and ask the nurses. In fact, I highly recommend this. If you're a hospital nurse, I highly recommend that you go around with a bag of chocolates and spend some time at each nursing station, talk with them, communicate with them, share with them, find out what their needs are and what they're struggling with the most. You can talk to the managers. You can look at the huddles to see what topics they're discussing there. You can look at the problems, the after actions that they've had to do on certain events that they're struggling with in that facility. In the clinical or in the academic setting, the situation is much the same because you want to address the same issues that they're dealing with in the hospital. So when you do clinical rounds, you can talk to the nurses there, talk to the managers there, talk to the educator there. The educators in our hospitals are the beating pulse of the hospital. They know all if they're doing their job properly. So talk to them, find out what topics are burning in their area. If your students know how to handle these topics before they are hired, imagine how successful they'll be. So these are ways that you can get that information. The next thing to do, once you've made a list of those problems, is to write SMART objectives. So figure out which problem you're going to solve and then write objectives about them and make them SMART. SMART, well, that's a whole other lecture. So if you're not aware of SMART lectures, I challenge you to Google it and find out. It's just about everywhere on the internet. And it's the right way to make objectives. Learning objectives are your focus. They're your whole purpose for what you're doing. If you try to achieve anything big and you don't have a plan in place, you don't have a goal that you're trying to achieve, it's very difficult to achieve anything. But if you have a goal that you're trying to achieve, then you will, at the very least, achieve that and probably much more. And that's the whole purpose of having an objective. Once you have the objective, you create a scenario, like a simulation, and you make a list of all the supplies that you needed, the people that you need, who needs to participate in it, and then you put it together, you test it, retest, and keep going. Or you can just pull up another simulation and turn that into an escape room. Now, we talked a little bit about the learning objectives. I liken objectives to a rabbit hole. You know, it's really easy to get lost on small topics. But if you focus on the main goal all the time, it's really easy to stay focused on it and to achieve it. I personally do this by writing it down on either a Post-it or a 3x5 card, and I keep that with me when I'm writing my simulations. And I keep it with me when I'm running the simulations and again, when I'm doing the debriefing. This helps me to stay focused on what I'm trying to achieve. But again, that's another lecture. Okay, so you can create an escape from scratch or just modify an existing simulation. And that's what this class is about. I'm going to teach you how to modify ones that are already in place. So the 12 steps, they're actually pretty straightforward. You make sure that you have a purpose or a goal with written objectives. This is important even if you take a sim that's already written. Take the time to clarify your objectives so that you know why you're doing what you're doing. That makes it easier to achieve them. Then find out who are the participants? Are they nurses? Are they doctors? Are they respiratory therapists? Who's getting involved? And so that you can gear it towards those people. Also determine how many people you need to attend. So if you need a large number to attend, you can have a large sim. Do you know an escape room, you can have about 10 people participate in an escape at the same time. Rather than 2 people in a simulation and 8 people watching, you can have all 10 of them actively involved the whole time. If you have enough room and if you have enough activities to keep everybody engaged. And that's kind of the trick, and we'll talk about that. Also, how long do you have? Before putting your sim together, you need to know what space am I going to utilize and how long do I want to spend this time? Keeping in mind that twice the sim time will be used for debriefing. Where is it going to take place? Is there room for the people that you need? Do you have all the equipment that you need? Make sure that you have available equipment. Then you're going to design the clues. Now, clues sound really easy to do, but sometimes they can be very frustrating. I'm going to show you some tricks on how you can design some clues rather quickly. If you are comfortable with AI, I highly suggest that you use AI. I use ChatGPT all the time. In education, it's a dirty word, but as an educator, it's a resource. Just understand that AI is not necessarily intelligent. It's really good at making things sound pretty, not necessarily good at being correct. But sometimes having something to start with makes it a lot easier to start than not having anything at all and starting from scratch. So it helps to start. Just use a very critical eye when you use it. Okay. Having clues and then determine how are you going to deliver those clues. Then you'll have to design some hints for assistance if they're struggling or not getting along or not finding the problems that you're intending them to find. How are you going to sneak in there and help them to move it along? Because remember, you only have 20 minutes, 15, 20 minutes. You want to make every minute count. And if they're just standing there scratching their heads, it's not going to do much good. So you need to come up with ways to help move it along when they get stuck. That doesn't break the flow of the sim. And then very, very important, write it all out. Write every detail from beginning to end. All these things on this list, write them out. Write out the way that you want it to flow. And then after you do some practices, write down how it did flow and what needed to change. And then make those changes on paper or in the computer, so to speak. But it's important that you have that because the next time you pull this out, it could be a year from now, and you may not remember all those little lessons that you learned along the way. So by having it documented well, the next time you pull it out, it'll be ready to go. And then I said practice, but what I meant was practice and practice and practice. So in simulation, it's really important to have a dry run because all the little things that you didn't think about, like is the right medication in the room? Do they have the supplies that they need? That kind of thing tends to come up during the dry run. But in an escape room, it's a little bit more challenging because some of this is based on how each person uniquely evaluates and sees things. So you have to do a couple of dry runs and you have to do it with different people. So the first dry run I usually do with the team that developed it because then we can see it from somebody else's perspective. But we already know the ins and outs of it, so that's not really a true dry run. So after we've done that, then I'll bring in a group of people who have not seen it and have them try it. Ask them to give us the feedback on that, on what we could do to improve it. We'll make some tweaks, some changes. We'll run it again. Even if it was perfect the second time, we still are going to run it again to make sure that wasn't a fluke or that somebody sees something a different way that we hadn't anticipated. And then after that, then you can begin planning it. But more importantly, survey every time you run it. Survey the people, even when it's not a dry run. Survey them to find out what they've learned from the simulation, because that's really the reason for being there, right? We need to determine if they've learned and how much they've learned, but also to survey how they felt about the simulation, things that they would suggest being done differently. That gives you an opportunity to improve later. And I'll even take it one step further. Survey with your team. So every time we teach a class at SimLearn, afterwards we do something called an after action response. We have a team meeting. Everybody who ran that class will get together and we'll talk about, okay, these are the things that went well in this class. These are the things we could do even better. Here's some ideas. Let's discuss whether we should try them or not. And then we make the changes on the spot, because if you let any time go by, things are forgotten. So within the next day or two, we try to make those changes. And then the next time we teach the course, it's all changed and ready to go. And we don't have to try to remember what we were going to do. It's already taken care of. So that's a good way to grow as you're developing. So let's talk about some of the things that you can use, some of the tools that you can use in escape rooms. So there are a variety of locks. So you notice the red lock is a directional lock where they have to push up, down, left, or right. There are numbered locks with 3 numbers or 4 numbers or 5 numbers. There's locks with letters that you can spell words out. There's locks with the old-fashioned dial. My favorite is the book that is a safe. For $10, you can get one on Amazon. They're great. Of course, there's the old lock and key. And then they have lock boxes where you have to get multiple locks open in order to open it, which is kind of a great idea. But the thing to keep in mind is, in an escape room for fun, the numbers are randomly found. In an escape room for education, everything must have a purpose. So if you're using a number or a word to open a lock, make sure that it relates to your objectives. What does it have to do with the simulation? What does it have to do with the learning? Is there a number that they would benefit from remembering? And if there is, use that. We don't want to just randomly throw out numbers and yay, they solved the puzzles and they're done, because then the objectives are not being met. The objective is for them to actually learn. Some other ways that you can hide clues. So there's a clock. You can buy that on Amazon. I'm not endorsing Amazon, by the way. It's just my favorite place to shop. But there's a clock that you can buy and it opens up and you can hide things in it. And then you can put the number on the clock to match one of the codes for the locks. I like to do this for stroke patients, their last known well time. That's one of the clues that I like to put on there. You can also buy a clock at the dollar store and cut the cord off and then just set it to whatever time you want and use it that way. There's decoders or decipherers where the numbers or the letters can be redesigned as numbers. So you can make a word clue and then they have to look up the numbers associated with that, or vice versa, in order to open the lock. Then they have to memorize the word and not necessarily the number. So that's one thing you can do. Black lights are great. Black lights you can very cheaply do. You can get the markers and write on I use giant Post-its. You know, those big presentation Post-its that are adhesive and you can stick them up on the wall. I love using those, and I'll write on them and I'll stick them up, and they're white. So if you put them on a white wall, they probably aren't going to get noticed. But when they find the black light and they start shining it around, they'll discover the codes that you want. Or you can write on the patient's arm, or you can get creative with that. You can also use a QR code. So if you want them to have a puzzle that's on the phone or a clue that's on the phone, they use the QR code, they find the clue or the puzzle, and look it up, and that helps to progress their movement. Another thing you can do is a passcode. So some people use like an iPad, and they have it mounted by the door. And in order to escape the room, you have to come up with the final code for the iPad. And when you unlock it, then it allows you to leave. I liked this trick, the lock on the scissors, but I have to warn you, learn from my experience. So I was excited about this. I put the lock on the scissors, and then I put it in the drawer, and I forgot to write down the combination to the lock. Yeah, we won't be using those scissors anytime soon. So now I have a system in place. I have pictures of all of my locks on a spreadsheet. And every time we change the combination to that lock, I put it in there because we're using them constantly, changing them constantly, and it's really easy to forget. And so that way, when I can't unlock it, I just go in and I look up the last sim that we did, and I can find the lock number that way. You can use Steam on mirrors. That's a little harder to do in our setting, but it's something that can be done. There's a decipher that they made with popsicle sticks and one that they made with cups. And you can put clues inside a balloon and blow it up, and they have to pop the balloon in order to get the answer. Hospital rooms usually have a balloon, or well, maybe not so much lately, but you can use that as an opportunity. Another thing is suitcases. I was walking my dog the other day, and somebody threw out a suitcase, a small carry-on suitcase, and it had a combination lock on it. And I thought, you see suitcases in hospitals. I bet you that would be a great escape room item. Another thing that I've done is, you see the colors and shapes puzzle. I got this at the dollar store. And what I did was I put clues on one side of each of these, and they had to find all of them. And I put Velcro on the other side, and they had to Velcro it on to I hung it on the wall, and they had to Velcro it on. And when all the pieces were in place, then they could escape. One of the clues that I used, you see on the bottom right there, that's the last known well time, which I used for the stroke patient to help encourage the clue. It was something that we were able to hand to them when they were struggling with solving that clue. Other things you can do, so go online. There are all kinds of free crossword puzzle makers that you can use to make crosswords, word searches, fill in the blanks, matching items, puzzles, all kinds of things that you can make. And you just put in the information that you want, and it turns it into a puzzle for you. It's phenomenal. It makes it very easy. I also use puzzles and posters. Puzzles I like because I will print a puzzle and put the things that I need them to know on the pieces, and then they have to put the puzzle piece in order to get the whole picture. And then I can just hide them in key areas around the room. But again, I don't just randomly hide them. I hide them in places that make sense for the topic we're evaluating, because then we can talk about where did you find these items and why were they there. It adds to the conversation. It's not just running around tearing things up. They have to remember the why. And I tell them that ahead of time. I also do posters around the room, and I'll maybe highlight or underline key things to give them a clue of their importance. Here's one of the posters this is the giant Post-it that we used. We stuck it up on the wall, and they had to find the 5 rules for hourly rounding. And there was a poster on the other side of the room that showed pain, potty, position, possessions, pump. And it's just something that had to be done as a group. This was I think it was folded up in a box. And when they got the code to unlock the box, they got this, they stuck it up on the wall, then they had to solve this as a group, and they had to all yell out the 5 rules for hourly rounding. When they did, the room was unlocked. So what it did was it just really gelled into place those key things, so that makes it more memorable. But even with escape rooms, there are pitfalls. So sometimes people get anxiety attacks. Feeling like they're locked in a room can be terrifying. So it's really important when you do a pre-brief that you let them know that you're not really locked in this room. It's not really an escape room. We're just calling it that you can get out at any time. We just ask that you don't unless you need to leave the game. You also have to be aware of abuse. Sometimes people get really full of adrenaline, they get really excited, and they want to find the pieces, and they start tearing things apart in the room, and that can cause damage to the room. So make sure that you give information on that ahead of time so that they don't do that. Sometimes you get shy people who are embarrassed or shy and don't want to say or do anything. And so they just sort of stand back and watch, and one person takes the lead and does most of everything. And so you need to have some kind of plan in place. How are you going to get that shy person more actively involved? And how are you going to get that leader to step back a little bit more? There are things that you can do for that. Sometimes they can't work the locks, especially the old-fashioned rotary locks, but we don't use those very often anymore. So it's really easy to forget how to use them. So that can be a problem. Or they'll get stuck on a clue and not know what to do. When that happens, it's really important that we have some kind of plan of action in place. So in order to avoid some of those things, the pre-brief is a huge key. It's a huge component. We're going to talk a little bit about pre-brief elements. This is common for simulation in general, but people think that escape rooms are different. You don't need to do pre-brief and debrief. But let me tell you what, they're more important than ever. So let's talk about the elements in them that we need to consider. So the basic assumption is the most important part of a pre-brief. It says that you acknowledge that somebody is there for the right reasons, that they're intelligent and they want to learn. Is that always the case? Not always. Sometimes people are voluntold. Sometimes they don't feel like being there and they have to be there. But we're going to treat them like that anyway. If you give respect, a lot of times you get it back in return. So it's important to keep that in mind. But one of the pieces of that basic assumption is psychological safety. You have to provide safety for them so that they don't feel like they're being judged or criticized. And in order to do that, you have to literally spell it out to them. Psychological safety leads people to feeling more engaged and motivated because they feel their contributions matter and they're able to speak up without any fear of retribution. It can lead to better decision making because people feel more comfortable voicing their opinions and concerns. It often leads to a more diverse range of perspectives. So in setting up psychological safety, it's as simple as, this is a safe environment. Consider this Vegas. We're here to help you to learn and to grow. And when things don't go well, that's okay. We're not here to criticize. We're not going to talk about this outside of this simulation environment. We're just here to learn. And that helps to set up the safety so that they don't feel afraid to try things or to attempt new things. Some of the specific rules for pre-brief are something that you have to consider for escape room. In other words, what can they do? Are they allowed to touch the patient? Are they allowed to open the drawers? Are they allowed to open the cabinets? Can they go into the bathroom? What are they not allowed to do? Are they not allowed to poke the live patient with a needle? That sounds silly, but it really needs to be said. We had a SimTech who had his ribs cracked during a CPR experience because they forgot that it was a simulation. They just got so engrossed in it that they forgot. So it's important to say what they're allowed to do, but also what they're not allowed to do. What can't they touch? What can't they move? Can they use their phones? So sometimes we say no phones because that's cheating. Other times we want them to use the QR code or maybe look up formulas or look up more detailed information. So phones can be very useful, but whatever you decide, whatever rules you set regarding phones, set that up in advance and let them know. Also, can they leave the room and return? So if I'm having a 20-minute sim, my general answer is, yes, you can leave the room if you need to, but you can't return because that breaks the fidelity. So if you need to go to the bathroom, now's the time. But if you do have to leave, we'll understand. You just need to go back. And can they ask for clues? And this is important because for me, I like winning, right? I like achieving my goal. And one way that you can do that is with clues. Remember, with this group, it's really important that they do achieve all of the goals, that they do find all of the puzzles, that they do solve all the riddles, that they do figure out how to escape from that room. Not only for them to feel successful, but because the clues are where the education is. So if they don't ask for clues, you need to find a way that you can subtly provide them. But you can also give them the option of calling out and asking for clues. That's really up to you to decide. Then, of course, we need to do an orientation to the room. Show them the equipment, show them the mannequin or the patient, show them how things work so that they'll work effectively. They'll be able to use them effectively and not make a mistake that costs them being able to complete the game. There's nothing worse than, and make sure that equipment is working, because there's nothing worse than something not working. One time we had a simulation and they had to defibrillate, and the defibrillator had been unplugged and went dead. And because we hadn't tested it right beforehand, when they went to do the simulation, we had no clue that it wasn't going to work. So just be aware of those small things. Explain at that time that the room is not really locked, and if they need to, they can leave. Now, showing sample locks and how to unlock them, that really depends. Some escape rooms, I tell them right out in the beginning, this is an escape room. Sometimes I don't. Sometimes I get a little sneaky. I have them go in and take care of a patient, and when they call for help, like a code or a stroke team or whatnot, when the team comes in to help them, then they're told, this is an escape room. And they're given more instructions at that point. And that kind of makes it a little bit more realistic and exciting because they weren't expecting it. But it really depends on your style and your learners. But at some point, you need to show them what the locks look like and how to unlock them, because maybe they haven't seen locks with letters on them or directional locks, and give everybody a chance to touch them and ask questions about them. What I usually do is I carry an extra of every lock that I use, and I bring that extra in that is not part of the sim, so that they can touch it and hold it and practice with it if they need to. Most of the time they don't, but once in a while you get somebody who needs a little help with it. The combination locks I try to avoid because people struggle the most with that. But if I were to use that, I'd make sure they understood that. Okay, then you're going to explain the rules for the clues. Now, the rules are going to vary based on your topic and how you're delivering it. Sometimes you want to tell them things outright. Sometimes you want to subtly hint things and let them figure it out. What I usually do is I'll tell them the clue that they first have to look for. That helps. And then what I do is I make one clue lead to another, which leads to another. And as they follow the chain, they don't all have to be explained. But if they know where to start, it at least helps. Explain what can and cannot be touched and accessed, which we've already done, and no damage. Make sure that they know not to damage the room. And then we'll do a handoff. So let me give you an example of a escape room that we designed. We teach a class called Introduction to Clinical Simulation, and we design simulation courses or simulation scenarios in that course. One time I suggested to my group, let's make an escape room. And we made this amazing escape room in just a few hours, which was really fun. So the scenario is, it's an 82-year-old Black female diagnosed with congestive heart failure, no pedal edema, alert and oriented ×3, lungs clear, no shortness of breath. We're preparing her for discharge this afternoon. I already gave most of her morning meds, but I didn't get to the Lasix. Here's the orders and the medications, and I'll hand them over. And then I'll tell them her vitals, which are all normal. And the door closes, and I simulate the sound of a lock engaging. And I tell them, help your patient to escape the room. So let me show you some of the puzzles that we used. So first, they did an assessment of the patient. The instructions were to begin with patient care. So go in and do an assessment as you normally would. And these are the things that they found. They found pinpoint pupils, low pulse, low respirations, altered level of consciousness, cyanosis. I gave some key letters in this puzzle, and then I laminated it, and I used a dry erase marker to give them so that they could fill in the pieces. Using these letters, it helped them to fill in some of the other letters until the words made sense, which allowed them to fill out the whole thing. And when they finished it, the instructions were solve the puzzle to treat the patient. And when they say that, then the standardized patient gave the first puzzle piece to them. And this allowed them to begin on their journey. Now, the puzzle pieces were hidden in key places. One was in a prescription bottle in the granddaughter's purse that at the very end she drops and it comes flying out. And that was the final piece that they had to find. And what happened with this patient was, and this is based on a true story, the patient came in with CHF and was being controlled for the symptoms, and she was just about ready to go home. The granddaughter came to visit, and the grandmother complained that she wasn't sleeping because of all the all the noises in the hospital. So the granddaughter gave her some narcotics to help her sleep. She went into a narcotic overdose. Now, this is not a typical drug abuser, so most people wouldn't think to look for it. But for some reason, the nurse on duty caught it and discovered what the problem was. And she knew that patient needed to be treated for a narcotic overdose. In doing so, she got an order for naloxone, but they didn't use the nasal naloxone. She had to draw it up. And she was very confused, and she fumbled with that because you have to waste 1 cc in order to mix it with the med in the syringe. And so that fumble cost a little bit of time. But in the end, the patient was saved, and she was able to give it. So what we found from that situation was 2 things. Number one, that we need to be aware that narcotic overdose can happen at any time to anyone. It doesn't necessarily have to be someone with a history of drug abuse or somebody that is stereotypical for it. The other thing we found is that the naloxone administration needed to be taught. Nurses needed to know how to draw it up and draw it up quickly. So in doing that, we were able to identify 2 of our main objectives: to identify narcotic overdose and to draw up and administer the Narcan appropriately, which involves drawing it up and administering over 15 seconds and then flushing with 10 cc's of saline. So these puzzle pieces were hidden all over the room. And you'll notice that there are numbers on here. On the top left, there's a 3. At the very top, there's a 0. On the bottom right, there's a 1. So there are numbers in there. At the patient's bedside is one of those bookcase safes. And she needed a number in order to do that. But what we did was, there's also a sign on the wall that said, what is a rapid response team? So if they read this, underlined is the 130. If their heart rate change, if there's an acute heart rate change and it's more than 130 beats per minute, that's when we want to call RRT. Well, we wanted them to remember 130 because, 110 is escalated, but 130 is when we start to worry. So knowing that is important. So we used that as the combination for the safe. When they opened the safe, they found the Narcan, and they had the instructions on the puzzle on how to give it. So they opened the safe, and they were able to get the Narcan and administer it. And then after the Narcan, the patient wakes up, and the patient gives them the final clue, the key to unlock the room. I think it was the Narcan dose or the milligrams administered, something similar to that, but that allowed them to escape. So again, a number that's useful to remember and something that is helpful in the objectives. So before I go any further, I think I've already given this one away, but where does learning happen? Well, since we have a small group, I'm going to go ahead and answer that. So learning happens in the simulation debriefing. One of the things that I studied in my dissertation was how to make nurses successful faster. And what we found was that nurses who took the time to reflect on their day, to think about what went well, what could be done differently, those are the nurses who were more successful and grew and changed. The ones who didn't, who were too tired to think about it at the end of the day and didn't take the time to, just went back to work and repeated the same patterns over and over again. So that's why reflection is so valuable. It allows us to learn from our experiences and to adjust them and be better next time. And debriefing is where that happens. So even in simulation, it's important to take time for the debrief. And in debriefing, well, I just explained that it helps to understand the why things happen the way they did, how you can make things better going forward. So let's talk about some escape room simulation activities. Here's an example of a tabletop escape room that I did. I went to IMISH and I gave this presentation, and I decided to incorporate small tabletop escape rooms for the entire group. Now, traditionally, when we go to IMISH, the classrooms are about 60 people in the class. So I designed escape rooms for 60 people. Well, when we showed up for IMISH, there were 140 people signed up for the class. So you can imagine how stressful that was. We had to rearrange our plans, rearrange the room, but we did manage to make it work, and very successfully, and everyone had a great time. So let me share what I did, and let's see how you feel about it. So we'll start with the handoff. You're covering for another nurse during lunch. You see the call light for one of the rooms and enter to check on the patient who asks if they can go to the bathroom. So there's 3 steps involved. First, you're going to identify risk factors for the patient's disease process. Match the keys to the locks, and they have to match 6 of them. So let me show you the locks. These are the locks and these are the keys. And these locks have emojis, and you have to discern what the emojis mean. So the first one, for instance, is high blood and pressure. The second one is a glass pouring out, which is pour, and then die, and then ET, so pour diet. This was designed by another class of mine in ICS, and they're brilliant. They put this together overnight and brought this in the next day for class, and we created an escape room with it, and it was so much fun because it really makes you think. Let me go. So these are the answers to all of them. There were 12 in all, but because not everybody is emoji capable, like I struggled with some of these, we asked them to only be able to complete 6 of them. So when they had 6 keys in place, then they would get to go to the next section. I had somebody called a key master, which I have them wear their little tags here. They would, one person at each table. We had a table of, I think we did 8 people at our tables, but I think 6 would probably be better for this. That the key master was there to give them guidance and make sure that they could get through the puzzles appropriately and to give them clues if needed. So the next step in this, after they've completed 6 of those, they get another envelope, and the envelope contains letter tiles. And using the materials, they have to determine the patient's diagnosis based on clues from the risk factors. So these are the letter tiles. I basically just printed up Scrabble letters and laminated and cut them out. And they had to find the words STROKE. And when you add all that up, that gives you a number. Now this is more random, but remember this was just for a tabletop explanation. So these numbers didn't necessarily have meaning. But when they gave that number to the key master, then they were given the final clue, the final item. But if they struggled in determining stroke from those things, I had a clue that the key master could give them. And in reading this, they should figure out that it was stroke, and they should figure out to add the numbers at the bottom. This gave them the clue that they needed so that they didn't get stuck and frustrated. And the reason I did this is because not everybody in the group were nurses or doctors. Some of them were non-medical professionals, and I wanted to make sure that everybody could participate in this. So once they discovered stroke and they had the number, they gave it to the key master, and we went to the third step where they would receive another envelope, and the envelope had puzzle pieces. Now, I actually had them colored, but on the left, you'll see that there's clues, and on the right is the Morse fall scale. So I had one side of the puzzle had the clues, and the other side had the fall scale. So in order to solve this, you had to read the clues and take notes, flip it over and do the fall scale, or read the fall scale and take notes, flip it over and do the clues. And what this did was this cemented in place the symptoms that they had to be aware of for the fall scale and how to complete the fall scale and add it all up. If I had a group that was really struggling because maybe they weren't clinical or they're just having a rough day, I had a paper copy of the fall scale so they wouldn't have to flip the puzzle over. But the idea was make it a little bit challenging, not so easy. So I really wanted them to read through it, flip it over, put it back together, read through it, and figure out the score. But if I needed, for the sake of time, I had the paper copy so that I could speed it along. So these were the clues on the left. And when they added them up, they came to the total score of 85, which is the combination for the lock. Now, one other key piece of an escape room is adrenaline. There has to be some kind of reason to succeed. If you give a group of people a puzzle, they'll take their time putting it together and there's no stress. But if you tell them that there's a competition, there's only one box that's locked and there's a surprise inside of that box that your team gets if you open it first, and everybody has to rush to be the first team to open it. Now you're creating that adrenaline that glues that memory into place. Everybody's excited and having fun and rushing around and trying to solve it in a hurry. And when they get to it, they go to the front, they unlock it, and they found a box of candy that they got to share. This was a small sim tabletop that we did at one of my classes. I broke everybody up into groups of 3, and they did this tabletop escape. And this is one of the groups that won. And it was exciting. They were all thrilled. Of course, they shared the candy with the group, but everyone had a good time and felt like they learned something. And as a result of that, afterwards, I could sit down and talk to them after all the excitement has settled. I could sit down and talk to them about stroke, what types of stroke there are, what they can expect with patients, and we can have a regular lecture. And the adrenaline is still there. It still is going to absorb in. So it doesn't have to be all simulation. It could be a short, simple activity with a timer involved to get that adrenaline and that excitement going. Okay, so I'm going to rush through the last few minutes. Just some tips for success. Laminate things so that you can reuse them, and then save them in envelopes so that when you store them, they won't get misplaced. Print them on different sets on different colored paper to help you keep track of which one is what. The clues, make a list of where you hide the clues. So if you hide clues in a room, make a list of where you hide them, because it's very easy to forget, and then you can't give them hints as to where they are if you don't know where they are. And try to make it competitive. If you're doing a tabletop game, make sure that you play the groups one after the other to make it exciting, so it's not just another activity to do. So a quick summary. We talked about the benefits of using the escape room in education. It helps decrease stress. It helps improve critical thinking and decision-making abilities, and it helps reduce burnout, among other things. We talked about how to develop ideas for an escape room, which is similar to developing a simulation, and how to use the simulation in a scenario for an escape room in 12 steps. Then we talked about the tabletop or mini escape experiences that we did here and how they were successful. as you know, with simulation, it's not about telling, it's not even about showing, it's about experience. And that is what escape rooms can do. They create a team sharing fun environment that allows people to experience in a way that makes it memorable in the long term. So I hope that you enjoyed this presentation. Are there any questions? I see Anu has raised her hand.
Oh, sorry, Helen, I was just clapping. Sorry.
Oh.
It was a good presentation.
Well, thank you. I'll take it.
Amazing. I really loved it. I learned a lot, make a lot of notes. Thank you so much.
Oh, you're very welcome. I have my email here, so if you have any questions, you're welcome to reach out at any time.
Thank you.
I do have
You're
how do you, what strategies will you use to align your scenario with the clinical competencies when you're creating a escape room?
Okay, so give me a topic.
I would, let's say, asthma. That's a simple one.
Okay.
Mhm.
Okay, so asthma. What do you want the learner to do? You want them to identify it? Do you want them to treat it?
A little bit of everything, yes.
Okay,
Right, and
all right.
yeah.
Okay, so then that's what you focus on. You focus on what are the symptoms of asthma. You can put those on clues. You can have your patient identify that, and then they have to come up with a way to resolve it. You know,
Mhm.
maybe the inhaler ends up in the final
Okay. Mhm.
the final clue when they have to treat the patient in order to win. Just make sure that all of your puzzles, all your riddles are related to asthma, identifying it and treating it.
Mhm.
Maybe you don't want a live patient. Maybe you just want the room and a patient went to X-ray and you can't remember what's wrong with the patient and they have to find clues as to what the problem was. And, you know, get creative. You can think outside of the box. As
Mhm.
long as you're addressing those items in your sim,
Right.
in your escape, and that's the focus of what you're trying to do, then there you go. That's what you want.
Thank you.
You're welcome.
Anybody else has any questions for Helen?
I have a quick question.
Yeah.
Hi, I'm Damian Cherry. I work with Advent Health. I was just wondering if they do get stuck with clues and things like that, you were saying. So when it comes to the actual numbers, do you build those clues into the room, or are you actually, and how much as a facilitator are you involved when it comes to cueing them to move on to the next clue? Like basically how much is too much, you know?
Yeah, well, you kind of have to pace yourself. So I don't like a lot of dead space in a clinical setting because that's time they could be learning. So if they're standing around and don't know what to do, that's when I'll jump in. I might throw on a lab coat and go in and as a doctor and give you know, a recommendation for, you know, maybe you should wash your hands before you touch your patients. And the clue is over by the gloves, you know, something similar to that. I like to progress the thing along. When you have a lot of people in a room, it's important that you have more than one clue that can be found at a time. If you have one clue that leads to the next, that leads to the next, and you've got 10 people, and it takes all 10 people to focus on one clue, not everybody gets to see it. But what you can do if you're doing a large group is have a clue on one side of the room and part of the clue on the other side of the room, and maybe it's attached to the wall, so they have to yell out information to each other in order to put it together to solve it. So you have to just get creative. And if that's the case, you might have somebody walking through and say, "Oh, you cut your poster in half. What's that about?" You know, and then they'll, you know, little things that you can do to try to make suggestions. But I also tell them if they get stuck and they want help, they can just call out for help, and we call it the voice of God, the speaker overhead. We use that speaker to to give them clues and hints along the way. So that's another way to do it. But I generally write down, for every clue that we hide, I write down a suggestion for a hint, because sometimes things are going crazy and you don't have time to think of creative ways to say it or do it. So I write down a way that we can go in if they're not getting it.
Thank you so much. This is great. Thank you.
Oh, you're welcome. And also remember to write down where that item is, because it's hard to help them if you don't remember where it is. I've done that.
Yes, thank you so much.
Right. Any other questions?
Okay, just want to thank Helen for this excellent presentation. On behalf of the Florida Healthcare Alliance, I want to thank you all again for being part of this, registering for this presentation. If you have any topics that you want to talk on future editions of this webinar series, please feel free to reach out to us and we can make that happen. All right.
Okay. Well, thank you. Thank you so much. Nice talking with you all.
Thank you.